Okay, in this video, we are going to be going over Chapter 9, the assessment of muscular fitness. So throughout this chapter, we're going to be discussing some components of physical fitness, some testing protocols, looking at maybe some things to think about prior to testing, during testing, different populations, younger, older, maybe some males, females, some different types of testing, not just the normal types of muscular fitness testing that we think of a lot of times, like bench press or squat or deadlift or anything like that. But we're looking at push-ups, maybe a sit and stand test for older individuals. Maybe even looking at just arm curls, really lightweight arm curls for older individuals. Those are some important tests that population can't necessarily do the normal tests that people like you and I could maybe do, like a bench press or a squat or something like that. So, and some other considerations for those populations, and what the whole goal of testing actually is. I mean, why do we even do it? And we've kind of gone over it a little bit. We need to have a starting point, at least at some point. So we go over some of that type of stuff throughout this chapter. If you have any questions, please don't hesitate to email me or Skype me or do whatever you would like to do. Get in contact with me somehow, some way, and we can discuss it. So enjoy. Chapter 9, Assessment of Muscular Fitness. Here we go. Okay, muscular fitness. So we're going to be looking at muscular strength, the local muscular endurance that we may have, depending upon what types of exercises we are performing, and also looking at the muscular power that is involved. A little bit different than just overall brute strength. Okay, muscular fitness and the goals of testing. So the whole reason why you test anybody is so that you have some type of baseline. Now, if you didn't have a baseline, you don't know how much you're improving. You don't know really what how far along you are in any type of goals that you may be having set forth, either that person or yourself. So you need to identify any weaknesses in certain muscles, certain muscle groups, certain parts of the body. A lot of different athletes do this all the time. Probably the best example I can probably give is a bodybuilder, even though that maybe not, might not be like a fitness type of thing, although they are fairly fit. They always see where their weaknesses are in certain muscles and try to get the same shape and the same size in certain areas. And the same thing with, say, a football player. If they're a little bit weak in certain muscle groups that they need for their particular activity, depending upon what their position is, they need to work on those types of muscles, maybe work on muscles and perform exercises that are going to help their quickness. Also identify any type of imbalances that could be in place, because maybe someone is right-handed and obviously their right hand or maybe their left or their right leg might be a little bit stronger than their left side of their body. So they need to work on those muscles as well. And also somebody who is maybe a little bit, I guess the best way to put this is they skipped leg day. Maybe that they have a weak lower body, so they need to improve some of the muscles in their legs, and also muscles in their core, not just the abs themselves, but also in the back as well, and that's part of the core. So designing training programs to meet some of these testing baselines that we have put forth because of the initial testing, and then also educate about the importance of resistance training moving forward. And the whole point, too, is to try to motivate and evaluate progress throughout a training regimen. Okay, health aspects of muscular fitness. So as we age, there is a perceived, or I guess enhanced, fat-free mass, and also resting metabolic rate. And along with that, the bone mass with aging as we become fit. It doesn't necessarily have to be muscular fit, but just any type of fitness is really going to, it's going to be perceived where we have a little bit more fat-free mass or muscle mass, if you will. And also our metabolism is going to be boosted, as well as bone mass is going to be maintained throughout our life cycle, especially as we get older and older. Those things do tend to decrease as we get older, but we can mitigate some of that loss by remaining active, either in some type of weight training, or even if it's cardiovascular, there's still going to be some weight-bearing weight-bearing exercises that we're putting on and stress we're putting on our body that's going to help to decrease the loss of fat-free mass or muscle mass, help and boost our metabolism, or at least keep it up to a certain level. It's still going to decrease no matter what we do, but also our bone mass is going to be maintained. And with that, there's going to be an improved glucose tolerance and also the sensitivity to insulin. And we know that with insulin, even just one bout of exercise, and you can increase that sensitivity with that one bout of exercise by performing multiple exercises throughout the week. And then there's also a reduced heart rate as well as blood pressure response during submaximal lifting as well. So there's a little bit of adaptation that we have for cardiovascular conditioning when we are weight training. However, there's not a lot, but there is still at least a little bit there. We're still working the body, we're still getting the heart rate up, still breathing heavily. So there is some type of response. It's just not as great as if we actually perform some type of cardiovascular training. Also, there is a decreased risk in musculoskeletal injury just simply by the fact that you have an increased muscle mass and you're able to withstand some of those deleterious forces that are being applied to the body. And also, as we increase our age, which we all do, not very many people decrease age, but as we increase our age, we have the ability to perform activities of daily living much better without falling and having any type of weird injuries that occur. Pulled muscles, strained muscles, potentially broken bones as we get older if we have that improved musculoskeletal fitness. And also, there's an improved self-esteem, knowing that you can perform a task and not have that increased risk for an injury or a fall. All right, so the performance aspects of muscular fitness. There's an enhanced muscular strength as well as a local muscular endurance. This should be fairly obvious as we are performing these exercises. Our body's going to adapt to the stress that we're placing upon it, in particular the muscles. So in this case, the muscles are going to be stronger. They're going to be able to endure more and more stress. There's an enhanced speed, power, the agility, your balance overall is going to be much, much better than if you did not have any type of muscular fitness. And also, there's a reduced risk for injury. And this is one of the key factors in why strength and conditioning is a prominent place in athletics now. It used to be, I'm not even sure what, probably in the early 1900s, probably even way up to the probably 30s and 40s, strength training it was seen as more of kind of like it was still health and it was still fitness, but it wasn't taken seriously a whole lot by athletes until they started to realize that injuries were actually decreased when somebody was performing muscular strength exercises. And with that, the added bonus to it is not only do you increase your muscle mass, but you tend to decrease fat mass. Again, some of this depends upon your diet, and each individual is going to be a little bit different. But the improved body composition is that you increase your muscle mass, you can decrease your fat mass, and that increase in muscle mass actually increases your metabolism, which helps to burn the fat. So this figure is simply showing the amount of repetitions versus what your end goal is. So anything that is, get my pointer out here. So the high intensity is obviously going to be these low repetitions. These are going to be really heavier weights, much, much closer to your 1 repetition maximum. And on the opposite end, the low intensity, that's going to be, really far down on the percentage of your 1 repetition maximum, usually right around 50% or even less in a lot of cases. And then you have the moderate range here as well. This moderate range, this 8 to 12 repetitions, and I've mentioned this before, and there's another chart that I go over sometimes too that shows essentially the same thing, is that 8 to 12 repetitions is actually really good for increasing muscle mass. And all 3 of these will increase muscle mass to a certain extent. All 3 of these will have some type of strength increase as well as some endurance as well. But to maximize the endurance, really a little bit more than 12 reps. You don't need to go as high as like 50 or 100 or 300 or 400 repetitions. Thinking a little bit on the lines of crunches. You don't need to go that high with exercises like that. The abs are like any other muscle. They are a type 1 muscle, but they're like any other muscle. You train them with a little bit more weight, a little bit more resistance, they're going to respond exactly the same way. But more than 12 repetitions, 12 to maybe say 20 repetitions. And it's a little bit lower intensity. It's a little bit lower weight. That's more for endurance. On the other side, for the strength and the power, you want to get below that 8 repetitions. Now, these repetitions are pretty much by the last couple reps, you are struggling to move the weight to do a full range of motion repetition for that. So this is really high weight. In this case, that's why it's high intensity. All right, so some pre-testing considerations that we need to take into account. There needs to be some type of standardized testing protocols, no matter what the testing protocol is, whether it's for strength training or whether it's for cardiovascular training. So proper technique is paramount for any type of training. Absolutely 100 positively needs to be proper technique. If it's not proper technique, you don't go through the full range of motion. I'm sure you can find some videos online of people not performing exercises to their fullest, to the full range of motion. The squat probably being the most prominent one there, where they don't go down the whole way. It's pretty much performing a half squat. Definitely not a good thing. You want to have the full range of motion throughout all of this. Also, the individual needs to be familiarized with whatever the exercise is, whether it's a bench press, whether it's squat, deadlift, whatever it is, especially if they're untrained or if they're a novice or if they've never performed the activity before. It's probably not a good idea. I mean, if they've done it in the past, it's probably okay to do a training session or two to get them back into the groove, if you will, for the range of motion that is needed and the proper technique. If it's a more complicated type of lift, like a power clean or a snatch, then you're probably going to have to go through some weeks worth of training just to get the range of motion and the technique down first. But something like a squat or deadlift, at least having them go through a couple practice sessions before going into a standardized testing protocol, which would usually be a 1 repetition maximum or potentially a multiple repetition maximum as well. Also, when you are prepared to do the testing, having a light warm-up, there may be some aerobic or some type of dynamic movements. The dynamic movements, say for a bench press, would be just doing a very light bench press. The same motion that you would be performing in the test, do it in the warm-up. So again, it needs to be sub-maximal. So don't put a bunch of weight on there and have them warm up 1 or 2 repetitions when that could potentially be their max. So a lot of times the bar, or maybe just have a couple 25s on each side, and it's going to be dependent upon each individual for that. But just making sure that they are properly warmed up prior to performing the test. All right, other pre-testing considerations, the specificity of the test. If the test isn't important, then why do it? So, for instance, if you wanted to measure somebody's sprint time, now this isn't necessarily strength training related, but if you wanted to measure somebody's sprint time, that's all well and good, how far they can run a 40. But if they are going to be running a marathon, the test isn't valid for what you're trying to do, what your end goal is. So if you want to do repetition maximum, because you're wanting to see how fatigued or how long it takes for certain muscle groups to get fatigued, or you want to do a 1 repetition maximum to see how strong they are or how powerful they are, you want to work those groups and test those groups that they're actually going to be using and that you want to test. So if you want to test the strength of your upper body, you wouldn't necessarily do a squat. So that's kind of an obvious one there. Also, the speed of contraction. A lot of this is going to be playing into the power output. We'll get into the power here in a little bit. And again, the test should be similar to what the training exercises are going to be. Safety. So supervision and spotting. There are protocols for certain exercises of how to spot properly. and also other supervision that needs to be taking place, especially if somebody is older, if they are a novice, if they've never been in a weight room before, if they've never exercised before. Some considerations could be even making sure that there might be a doctor on hand, depending upon what the test is. We've kind of gone over some of that earlier in the semester. There also needs to be clear instructions of what to do, and also what to do if they start to feel like the weight is slipping, such as in a squat. You don't want to tell them, no, just keep pressing it up. You probably want to say, hey, if you feel the weight start to roll off your back, just leave it go, let it fall. Either the rack will catch it or it'll fall to the ground. No harm done. Stuff breaks. It breaks. Well, whatever happens. The safety of the individual is the most important thing. Weights and bars and all that stuff can be replaced. It's kind of tough to come back from a very crushed foot or a broken back if they fall, or even worse. Also needs to be in a climate-controlled environment. So indoors is what we're discussing here. So it needs to be in a room that is not too hot, not too cold, kind of that Goldilocks effect. Now, it can be a little bit warmer. Obviously, gyms can sometimes be somewhat humid. People are sweating. Body heat gets increased. I mean, it's going to be somewhat warm potentially, but try to minimize some of the overheating that could occur. But at least a climate-controlled environment. You don't want to be outside in the snow or anything like that doing a lot of this stuff. Also, the interpretation of the results, the health criteria or the population-specific norms that the individual is in, and also the percentage improvement in absolute or relative terms. What that means is basically the absolute amount of weight that somebody gained in their bench press or their squat or whatever exercises it may be, or maybe how much weight that they lost, how much muscle mass that they gained, or it could be relative not only to themselves by a percentage of body fat, percentage of fat-free mass, percentage of increase in strength, but it could be relative to other people in that same age class and gender as well. All right, looking at muscular strength. Isometric or static. So if you take your hands and press them together, it's basically the same thing. So strength at one specific point in the range of motion. So the peak force obtained is also known as the maximal voluntary contraction, or MVC. So just a couple terms there. The isometric strength, we've probably all heard of it. We've gone over it before. We've seen some examples of it. I may or may not have seen the maximal voluntary contraction, but that is the peak force that is coming about. So the voluntary contractions of the skeletal muscles is what we're discussing here. Another one would be the isokinetic, and that is the strength throughout a range of motion at a constant angular velocity, or a peak rotational force. So this type of test actually requires a computerized piece of equipment. This equipment is known as a biodex. So you can kind of see it down there on the platform. So a test like this, or the machine like this, is quite often used in rehabilitation centers. It's also used in research testing, and it can do a number of different joints. It can do the knee, it can do the hip, it can do the shoulder, the elbow. I believe there's one for the neck as well. This piece of equipment needs to be set up properly for each individual. And basically what is happening is, and I'll give you an example of a test that I did in a research protocol, is that this machine is actually braked to where you can apply as much force as you possibly can throughout the entire range of motion, the whole way up and the whole way down. So just doing one kick of one leg. So you're applying the maximum amount of force throughout the entire range of motion. However, the speed or the angular velocity of that arm is actually staying exactly the same. So you're able to apply as much force as you need, but the angular velocity is always remaining constant in that case. So it's basically measuring how much force you're able to apply throughout each individual point throughout the entire range of motion. So again, sometimes it's used for rehabilitation to determine how strong somebody is getting in maybe one particular joint or muscle group, but also in research practices as well. All right, now on to dynamic. This is what we normally think of when we think of resistance training. So the movement of a body or an external load. We're actually moving something. We have movement of joints. either back and forth, up and down. There's going to be eccentric, concentric contractions. So, for example, a push-up, a bench press, leg press, we can go through all the different exercises, but that is the dynamic type of movement. So the maximal resistance and minimum repetitions is going to increase the amount of strength that is gained. Again, going back to that chart with less than 8 repetitions is going to be where you're going to get most of this strength gain from. So high resistance, little repetitions from this. All right, repetition maximum testing. Probably one of the most common methods of testing, especially in a bench press or a squat or a deadlift. And this one is usually performed on a Monday if it's a bench press. That little joke there. Monday is International Bench Press Day. Nobody forget that. Anyway, so the heaviest weight that is only lifted once, and also using proper form. Remember that. It has to be proper form. If it's not proper form, then it's not a lift. It's not a full lift. Again, the same thing with a squat. If you don't go down the whole way, it is not actually a squat. It's a half squat or something else other than a squat. So the 1 repetition maximum, or the 1 RM, is typically seen as the gold standard. It's mostly multi-joint exercises, so bench press, the squat, the deadlift, those are multi-joint exercises, and they're also using and utilizing multiple muscle groups, so not just one particular muscle in that case. Also, the 1 repetition maximum, or near 1 RM, it's relatively safe for adults, even with people with coronary artery disease, type 2 diabetes, or any other risk factors, as long as they don't have any major joint problems, or if they don't have any, if they just come out of a heart attack, basically, had heart surgery, open heart surgery recently, they should be okay. But caution should be taken, people who are pregnant. One of the risk factors there, if you're lifting with something over the head, making sure there's precautions in place, either racks or maybe even switching over to some type of Nautilus equipment or machines. All right, multiple repetition maximum. Most of the time it's 4 RM or 8 RM. It can go up to 10 or even 15 repetition maximums. Those are also popular. Again, these are using proper form throughout each and every repetition. So they're useful alternative to 1 RM if some type of stable chronic conditions like hypertension or diabetes aren't really well controlled, because especially somebody who has hypertension, when you are lifting a lot of heavy weight, the blood pressure will increase drastically. I mean, really drastically. The systolic blood pressure can get up over 300 millimeters of mercury just with one bench press, or even a squat or a deadlift, especially if they're not breathing properly. So multiple repetition maximums could be beneficial for those individuals. So minimizing error and establishing training loads. So these are compared to the 1 repetition maximum. So for example, 10 repetition maximum is roughly about the same as what your 75% repetition maximum is. Your 1 RM actually is. All right, interpreting the results. So express strength as a ratio of weight that's lifted relative to the body weight. So the strength ratio from a 10 repetition maximum test. So determine the heaviest weight that the person can lift 10 times. So that would be the 10 RM. Convert the 10 RM to 1 RM. It's basically just dividing the weight that you got by 0.75, and that gets you the 75% approximately. And then just divide the estimated 1 RM from what we got up here, that division by 0.75, by the subject's weight in that case. So that's a strength ratio that somebody has, basically a pound per pound representation of how much they can lift or how strong they are, at least in that particular exercise. All right, normative strength scores. Most of the time these are going to be derived from age and also gender. Sometimes they're derived from athletes, non-athletes, maybe even races, but most of the time it's mostly divided by age and gender. So the norms used should be derived from the test that is used of the same equipment. So if you're performing a 1 repetition maximum bench press on a actual free weight bench press with a bar and plates, that's what it should be compared to, not a press like on a machine. Not going to be the same. And the same goes with a squat as well. If you do one on a Smith machine, it's going to be different than if you actually do a free weight squat. So the upper body, most often either a bench press or a shoulder press. On the lower body, you're having a leg press or a leg extension, and more of kind of a overall strength. Probably a squat and a deadlift are also ones as well. You can get into some of the Olympic lifts, but those aren't as popular through amongst the general population, but they are still popular. Pre and post training comparisons. So eliminate the need for normative data. So this is why you do the pre-testing, is so that you can compare it to at least some other point in time, either in the middle of training or at the end of training, to see how much somebody actually gained or lost potentially. So it eliminates that need to actually collect some of the normative data. You're comparing the individual to themselves essentially. So the frequency comparison depends upon the quality, also the quantity of training, the desire for the information. Maybe the client doesn't want to know right away. Maybe they want to wait a year. Maybe they want to wait 2 years. It shouldn't be 2 years, but it should be at least probably every couple months that they want to get some type of data of how they're improving. Most of the time you can tell if someone's getting stronger, plus they might be able to see it in the mirror as well. And also staff availability and equipment availability could also play a factor in that as well. So the percentage of improvement, just basically taking the post-training minus what they started with in the pre-training, then divide that by the pre-training value, then multiply it by 100 to get a percentage then. Like strength and local muscular endurance. So one of the common tests that is used in local endurance training or endurance performance would be the push-up or the upper body. So the standard position, the norms developed for men, and then you have a modified position developed for the females. So the hand position is standardized. However, the starting position is actually a little bit different for men and women, at least for the standardized position. So this position use should be based on strength, but not necessarily the sex or the gender of the individual. So there might be some females that are strong enough to where they can perform what is developed for the men. There might be some men that need to use the position that is developed for the females. So it's not a knock on anybody, but it's just kind of the way things are. So tests are not adequate for assessing muscular endurance if the minimum of 15 repetitions cannot be completed. So anything less than 15 repetitions, you really ought to at least try the female version of it or the modified position, or maybe even use a different test for upper body. So this is the standard versus the modified position. So you have the standard push up over here, and then on the way down, again, the whole way to the ground, no kind of just dipping the chin down. And then over here you have the modified position, and again, still going the whole way down, touching either the chest or the chin to the ground, but you're still going the whole way down. Again, not just dipping the head down or going down a couple inches. It needs to go down. You need to go down the whole way to the floor. So one of the common mistakes with push-ups. All right, just a chart here looking at the categories by age and sex for push-up and the number that is completed for the push-up test. So you can take a look at this here. Most of you are probably in this 20 to 29 years of age. And you can see excellent is greater than 36 for males and greater than 30 for the females in that case. And again, it doesn't matter which one that you perform, whether it's the modified or the standard. Look at male versus female for your particular gender and age in that case. All right, another one is the YMCA bench press test. So this is an alternative to the push-up test for local endurance. For those of you that are experienced with lifting free weights, so it's 30 repetitions per minute is going to be the count. So you would actually have a metronome going for this test. And the weight for this, and this is one thing that we would actually do if we were still in class and we were still performing this in the lab, but the men would have 80 pounds on the bar. Well, they would have 80 pounds total. They have the bar plus usually the 35 pounds then from weights. And then the females would have a 35 pound bar. So it's a fixed load. Might be too light for fit people, but it's also too heavy for older people or deconditioned individuals. So just kind of bear that in mind. If someone's really fit, they're going to perform really well in this test. If they're older, if they're really weak, they may actually not be performing very well on this test. So again, this is a test for middle of the road. I guess the average overall population should be able to perform this test at least some repetitions, but it still might be too heavy for some, but maybe way too light for others. And again, another chart just showing the norms for males, or this is actually for females in this case, and the age up here. So the age classes are a little bit different for this one, 16 to 25 and 26 to 35. And why they actually separate that, excuse me, right around age 25, that's usually right around the age that we start to decrease our muscle mass, roughly 25 to 30 usually. So, but on average, it's somewhere between 25 to 30. So that's where they put the delineation. So, and they wanted to separate it by 10 years apiece anyway. So you can see where you may or may not have fallen. So if you have access to a gym, I'm not sure if you can do it now, but at least some point you have access to a gym, or if you are on campus at any time and you want to perform this exercise, feel free to stop in. We'll try to get you set up with it to perform this test. But if you have a 35 pound bar or at least 80 pounds for a barbell, you can perform the test and kind of see where you fall. Okay, moving on to another test. This one is mostly for older adults. So you're looking at the normal range of scores for 30-second chair stand, as well as the 30-second arm curl test for the older adults. So in this case, we have age, and you can see it starts at age 60 all the way up to 94, which is getting pretty up there for standardized testing, and also differentiated between females and the males. So the chair stand test, these chair stand tests are sitting down in a chair, just a regular chair, about roughly 18 or so inches above the ground, and then standing up and then sitting back down. So that would be one full repetition. Performing that without having to brace oneself or push themselves up off of the chair. So without using their arms, standing up and then sitting down, standing up and then sitting down, and also doing it in a way that they're not becoming unbalanced or falling. The arm curl, or the number of arm curl repetitions, these are with a certain amount of weight. For individuals, it's a really light weight. In fact, sometimes they even just use a can of soup a lot of times for that. All right, senior fitness test, or SFT. So functional fitness test battery. There's a bunch of different tests that older individuals can go through. They don't need to be on a bench press or a squat or deadlift or anything like that. They can go through different testing. They can still say the same thing and still have some type of outcome to show how strong they are, but not put them at risk for maybe injuries or falls. So it still evaluates strength, endurance, agility, balance. Balance is really the key once we get older and older. Identify the baseline strengths, weaknesses, as well as the effectiveness of any exercise programming that is put in place. And again, pre as well as post. And again, we've seen before the norms are for men and women ages 60 to 94. And these tests also correlate fairly well with other strength tests that have been performed on individuals of the same age class. So correlated with their one repetition maximum. So some of the strength or the senior fitness testing can be a 30-second chair stand test, 30-second arm curl test. And again, here it's showing 5 pounds for women and 8 pounds for men. Again, it is really light. Again, sometimes they use soup cans, kind of like the family size soup cans. 6-minute walk test, see how far they can walk in a certain period of time, as well as looking at their heart rate. The 2-minute step test, chair sit and reach test, so that's trying to touch your toes. The back scratch test, And we would have performed this one in the lab as well, basically reaching behind your back and seeing how close you can get your fingertips together. The 8-foot up and go test, so standing up from a chair, going 8 feet, and coming back. And then seeing how long it takes them. Then also looking at height and weight, just in general, and following their height and weight as they go along through through not only the testing but also the exercise program. So this is the 30-second chair stand test. Again, the individual is placing his hands on his chest, standing up, and then he'll be sitting down after that. Again, not using the hands at all. The 30-second arm curl test. So just looking at how many repetitions the individual can perform. Most of the time it's done with one hand only, or they might switch hands and look at the difference between right and left. But they could use both if they wanted to. All right, looking at clients with cardiovascular disease. Now they are at risk for certain things, especially if they get their heart rate up way too high. But resistance training is supported by the American Heart Association as well as the American College of Sports Medicine for people who have cardiovascular disease, especially for like moderate intensity, that 10 to 12 or 10 to 15 repetitions of resistance training, and also training that can be performed safely. Again, safely by low-risk cardiac patients. Especially stuff that is over the head, try to minimize those types of lifts because they could, if they do happen to have an event where they might get weak or maybe potentially even pass out, then that weight's coming down on them. So if they can have an exercise, if it's free weights, if they can just drop the weights on the floor, hopefully the floor can hold it, but as long as it's not dropping on them. But also using machines for these individuals is definitely a good thing to do if they are available. Now, making sure the patients are absent of any type of angina or chest pain. The ST segment changes in the EKG or ECG, that's dealing with basically how stressed their heart is and whether or not they are at risk for a heart attack or maybe potentially have had a heart attack, and also any other complex ventricular dysrhythmias, So any type of valvular problems, those individuals need to make sure that they are well enough to exercise, especially with resistance training, because again, the blood pressure can increase. The key thing here too is making sure they understand the type of breathing that needs to occur, trying to avoid the Valsalva maneuver, basically closing off the airways as they're lifting. So they need to be breathing while they're lifting. So clients with the cardiovascular disease, monitor resting and also recovery blood pressure, making sure it doesn't get too high. If there's any type of abnormal physiological responses, stop the activity immediately and then see a doctor, maybe even have a doctor on hand potentially, depending upon where they're performing these exercises. But making sure that someone is there with them just in case something does happen. If they need to perform CPR, maybe potentially get an AD if something does happen, but also calling 911 if something tragic happens as well. So multiple repetition testing is probably the main test you want to perform here. 10 repetition maximum versus the 1 repetition maximum, that's what we're talking about. It's going to be a little bit less risky and just more sensible for somebody who has a cardiovascular condition. All right, children and adolescents. This is, at least used to be a controversial topic up until maybe 20 so years ago. We know that children and adolescents benefit, even prepubescent children benefit from strength training, again, under proper supervision, as long as they're doing the full range of motion. There's improved strength that is still associated with it, even with younger individuals. Improved posture, or a reduced risk for injury, as well as an improved body composition. They do tend to have a little bit less likelihood of developing type 2 diabetes, as well as becoming obese as well. They also tend to have enhanced motor skills, and some of that is with strength capabilities that they have in motor performance. So the one common test that is performed in children and adolescents, especially in schools, is the push-up test. So this is physical education programs and YMCA's perform this a lot. maximal load lifting, 1 to maybe 10 repetition maximum. Some youth centers and also pediatric research centers will perform this. Sports teams will still perform it. Really not necessary for somebody who has not gone through puberty yet, especially if they're not maybe in high school athletics. It's really probably not 100% necessary, if necessary at all, depending upon what they're getting into. Repetition maximum might be the most beneficial test for them as they are younger, but as they get older, especially once they reach puberty, 1 repetition maximum, as long as they can perform it safely, they have good supervision, then they should be able to perform that test. Now, there is a FitnessGram, and that's a standardized fitness test program that is performed sometimes. And basically, it's just taking in a whole bunch of different tests, upper body, lower body, looking at even some cardiovascular fitness testing, and kind of compiling it all and comparing it between children of the same age group and also gender, and seeing where they are along their strength capabilities. All right, children and adolescents, again, continuing on with this, focus on the quality of the movement, the physical effort, and also improvement rather than the actual amount that is lifted. If they don't gain 100 pounds on their bench press in a year or 50 pounds or whatever it might be, it's not the end of the world. They're younger individuals. They should be okay. As long as they are improving, should be fine. And if they're having fun. When it's younger individuals, especially children, we're talking anywhere from 8 to 10, 12 years of age, they should be having at least a little bit of fun with it as well. So during the training assessments, give adequate demonstration and allow time for them to practice the lifts with low weight. Sometimes it could even be using a broomstick. In the case of a bench press, some people might, or some younger individuals might not be able to actually lift the bar. So just having them use like a broomstick or maybe a PVC pipe, something like that, so they can get the motion down and get the right muscles moving at the right time, kind of that neuromuscular adaptation for that. Sorry, I fell asleep during that. You guys know I joke. Anyway, that's chapter 9. If you have any questions, let me know. We kind of ended it looking at children and adolescents. The key point there, especially with the different populations, is everyone's going to be a little bit different, and that older people, some of them may be able to perform the regular exercise testing that we can, that the younger crowd can do, like a bench press or a squat or something like that, especially if they've stayed active throughout their lifespan. And maybe their joints are still fairly healthy, but some of them can't. So we need to take that into consideration. Also with children, some of them may be experiencing it. Maybe they have a parent or a friend or someone they know how to bench press. They know at least a little bit about a squat. Maybe, again, you're not doing a full 1 repetition maximum bench press with them, but at least they know how to do it. And you can do a multiple repetition bench press or a squat or something like that with them. But you can also still do some of the other testing like push-ups and sit-ups, some of the stuff that they do in like the FitnessGram type of stuff that they do in the high schools and the elementary schools. So you can still do that stuff on the younger crowd. But most of the time you're going to get more of a benefit if they actually do some of those actual free weight or potentially machine exercises and testing methods. So anyway, if you have any questions, please let me know.